A veteran says the VA couldn't supply him with the insulin that he depends on. He was left without medicine due to a computer glitch. Channel 5's Frank McCaffrey explains what he had to do to get help. He also spoke with a veteran service officer about what happened.
Vietnam veteran Feliciano Quadra Jr. battles a number of health problems.
In '73, I had started having a lot of skin problems. Then I developed high blood pressure. I developed cardiovascular disease. I had kidney problems, and renal failure. I've had 6 heart attacks.
Over the years, he says doctors have been telling him these problems are related to his military service. In 1987, he is diagnosed with diabetes and has needed insulin ever since. Quadra claims it's been getting harder for him to get the proper dosage of insulin from the VA.
I knew it wasn't enough because I used 100 units every day. And so I went to the nurse and I told her, look, I'm going to run in a few days, I'm going to run out of insulin.
Quadra tells us he noticed he was running out, so he called the VA in Harlingen. He says the VA representative told him he would be given extra insulin. But when Quadra tried to pick up his medication last Friday,
they told me the computers are down, we cannot give you nothing.
This morning, after a weekend without insulin, Quadra called a nurse to describe symptoms of pain in his stomach he was experiencing.
He said, you better go to the emergency room right now because that's an indication that pain, it can cause kidney failure and you're going to die.
Went to a hospital in Harlingen today. He says he had to use Medicare to pay for his treatment and for insulin. The VA did not have a contract with the hospital he visited. Felix Rodriguez, Hidalgo County Veteran Service Officer, says the problem was clearly within the VA office.
There must have been some lack of communication there someplace between the VA clinic and certainly not the veteran's fault, okay? Somewhere along the line, somebody dropped a ball.
We reached out to the VA in Harlingen. They tell us when the computer system crashed last week, their health care system immediately implemented continuity plans. This was done to ensure the continuity of care for veterans. Rodriguez adds someone like Quadra simply must act to defend their own health if they need medicine. He says they must act quickly if they feel the VA is giving them the runaround.
If you need it absolutely, say you have a very serious case, say diabetes or whatever the case may be, and you need the medication immediately, then I would purchase it, out of pocket, then perhaps engage the VA and see about getting reimbursed.
Rodriguez adds if you're trying to get a reimbursement from the VA, let them know it was not your fault and you needed the medicine quickly. In Mercedes, Frank McCaffrey, Channel 5 News at 6.